Good afternoon. I would like to thank you again for this opportunity to speak to you. I would like to announce that I will be extending our public health emergency by 14 days. Details will be published in an executive order which will be issued tomorrow. I will also be closing parks and beaches with detailed guidelines to follow. And now I know many in the community continue to have many questions about COVID-19 outbreak in Guam. First, I want to assure every one of you that we are doing everything in our power and we will not stop until we can eradicate this virus from our island. We're working every day, day and night, to protect the community and stop the spread of COVID-19. We realize, however, that the work of the government is not enough, which is why I issued an executive order calling for the shutdown of non-essential businesses and mandating social isolation. But the numbers continue to climb. So I've asked internal medicine physician Dr. Felix Cabrera, who also specializes in medical technology, to give a presentation on trajectory and data. Now, what you hear from him may alarm you, but I believe this information will help us all to better understand our situation and take social isolation more seriously. I'd like now to have Dr. Cabrera address you.
All right. Well, thank you very much, Governor. Thank you very much, Governor. Hapaday, Guam. Again, my name is Dr. Felix Cabrera, and I'm here to present Guam's estimated trajectory for COVID-19 cases and the impact for hospitalized patients. This is a presentation by the Governor's Physician Advisory Group. So what I'm presenting here is what we already know in terms of Guam's COVID-19 positive cases. Starting from day one, we had 3 positives. And on this column, you can see how many new positives were per day. And on the right column, you can see the total amount counting since day one. Plotting them out here, you can see that the blue line are the totals since day one and how they've added up. So we are now at 27. And on the green line here, you can see how many additional daily COVID-19 cases there were, which in yesterday's case or last night's case, there were 12. So the question is, how does Guam compare to the rest of the world so far? Well, when we look at this graph here done at Johns Hopkins University, they graphed out all the countries that are dealing with COVID-19 pandemic. And as you can see here, the Western countries follow mostly the same trajectory, and this is with their social isolation and distancing and hygiene methods. But overall, the average was about a 33% daily increase throughout all the countries. Of course, you can see South Korea, Japan, Singapore, and Hong Kong all were able to flatten the curve and are doing much better. And they did it doing a variety of efforts and a multi-pronged approach. So how do we match up? On this graph here, you'll see the green here represents a trajectory based on the spread rate of Western countries throughout the world, which is about 33%. The blue is us here, and this is our cumulative or total COVID-19 cases. And as you can see that we're actually really matching up pretty well with the majority of Western countries. So the next question after that is, what does this mean for Guam's hospitals with a spread rate this fast? So let's look at Guam's combined civilian hospital capacity. Now, I know that we're trying and doing our best efforts to separate both GMH and SNU to be the COVID hospitals and GRMC as the non-COVID hospitals. But for the purpose of this presentation, I'm just going to combine them all to look at our overall capacity. So the approximate beds, and this is approximate because these numbers are changing rapidly, even hour by hour. But let's just say a nice round number is that the total hospital beds is 350. So the bed capacity based on nursing staffing levels is approximately 250. And this has always been a chronic problem for us here in Guam, and we're already at this essentially. So that leaves the total unstaffed bed space available about 100. And we all know that a bed is not useful unless it's staffed by a nurse and the rest of the healthcare team. For total ICU beds, we're looking at about 28. And ICU capacity based on nursing staff levels, which are again already reached, is about 13. So that leaves about 15 unstaffed ICU beds available. And as a result, it's 85 of the non-ICU beds available. So what does this mean? So even before COVID-19, we've been, for those of you who have played Tetris and you're getting to the point where you're almost about to lose, you're scrambling to make room for the bricks as they keep coming through. Now, we've been at that point even before COVID-19. Now the bricks are coming much quicker, and they have the potential to overwhelm our system here. So for the purpose of this presentation and these numbers, we're going to use this 15-bed ICU as basically the critical care system breakpoint. And what will happen here is that the death rate from COVID-19 will skyrocket from here, if not earlier. So then the next question after that is, when will we get to that breakpoint with death rates skyrocketing? So if we look at our trajectory on what we showed earlier, where there's a 33% daily spread rate, this blue line represents how many people will be testing positive for COVID-19, the number of cases along this time period. And Monday, March 23, that's today. The green line represents the estimated amount that are going to be hospitalized, okay? And that's assuming a 20% of infection of those who are infected requiring hospitalization, which was similar in Wuhan. And the yellow line, or the orange line here, represents the estimated ICU patients, which is 20% of the hospitalized patients. And so when you look at this, we've already talked about 15 ICU beds or 15 critical care patients that are going to influx the system due to COVID-19. At our current spread rate, Guam's critical care system breakpoint could occur by next week, if not sooner. Although still alarming, the current daily spread rate of 33% is because our strong current efforts. But it also could have been much worse. What would be our current situation if we took no precautions from the beginning? This is what it would have looked like. So if there was no government of Guam and community interventions done from the beginning, you're looking at about 200% daily spread rate that would have been seen. And that's how infectious COVID-19 actually is. And this is what our trajectory would have been, as you see here again with number infected, number hospitalized, and number needing the ICU. And if we look at 15 again being that threshold, that would have been yesterday. So because of our current efforts with everyone doing social distancing, washing your hands, covering your cough, we avoided having a breakpoint yesterday, but we've only bought time. So we are bending hard, but by aggressively slowing the spread rate, we might prevent a break. And so that's where flattening the curve really, really matters. And we can definitely do it. Can we make enough aggressive changes, but this quickly on top of what has already been done? Well, the simple answer to that is yes. Everyone must take all our governor's orders and precautions advised very, very seriously. Most important is strict social distancing and very frequent hygiene. I'm not just talking about hand hygiene, I'm talking about hygiene throughout the house and everywhere you go. The manamku and all those with chronic medical problems like hypertension or high blood pressure, diabetes, heart disease, and especially those on dialysis are the most vulnerable and need additional protection and isolation. They are the highest risk of dying from this disease. So what do we need to do from here? Today, if we cut our spread rate in half, if we flatten the curve by half, so instead of 33%, we're looking at 16.5% of a daily spread rate. This is what it will look like based on our actual numbers. So if this is today here, March 23, and our trajectory of number of cases, this is how the curve looks like now. The estimated amount of hospitalized and the estimated COVID-19 ICU patients will start flattening. And basically, if we cut in half our current spread rate, Guam's critical care system will have a chance to bend without breaking. Will people still die from this disease? Yes. Can we do a lot to save many more who don't have to die from this? Absolutely. Thank you.
Thank you, Dr. Cabrera. I also today have been working with Rear Admiral John Manoni, who has developed a plan that will be released to media shortly in regards to the veterans' access to the base commissary and exchange with schedules that minimize public health risk for all. He indicated that he is updating Speaker Barnes about the veterans' issues of this situation. He also indicated that he would forward their media release to the Joint Information Center at Guam Homeland Security and Civil Defense, and we will then be releasing that. Thank you. Okay, so we're gonna have Linda now talk about the number of cases, some demographics, and then we will open it for questions.
Thank you, Governor. As of today, we have a total of 27 positive cases, 131 negative cases, a grand total of 158 cases. In regards to our areas of where these patients are, the positive specifically for COVID-19, there are a total, as I mentioned earlier, of 27 cases. 20 are in home isolation, 2 are in SMU, and 5 are at GMH. In regards to the demographic information of these 27 patients that tested positive, 5 are at northern region of the island, 12 are at central, 4 are at southern, and 6 unknown. So that gives a grand total of 27. In regards to the age group distribution, we have those that are below 19, 0. Those that are 20 to 29 years of age, 3. Those 30 to 39, 3 as well. 40 to 49 years, 5. 50 to 59 years of age, 4. 60 to 69 years of age, 9. And none in the age bracket between 70 to 79. And for the age group of 80 to 89, we have 2. And those that are 90 and above, 1. In regards to the gender demographics, we have 10 that are males and 17 that are females. The medical status, we have 15 that are stable at this point, 12 are fair. And so in regards to travel history, of all those that we've identified of the 27 positive cases, 1 came from Japan, 5 from the Philippines, none from Korea, 1 from the US mainland, and 20 had no travel history at all. And currently we are implementing our quarantine measures, especially for those who have traveled and are entering into Guam. And right now we have 4 main hotels where they are being quarantined, a total of 241 passengers that have already checked in into these hotels. And just to give you a little bit of a heads up, the governor has already appointed a medical advisory council also to determine protocols for commercial testing, which will be available very, very shortly. Thank you.
So we are open now for questions.
Nick Delgado, Guam Post. So you said that the 20, you just said that the 20 of the cases remain in home isolation.
Yes.
At what point are all of the confirmed cases going to be sent to the COVID isolation facility?
So the surveillance team are working very closely with these individuals, and they are—
Listen to that press conference. Have you tried that Zoom yet? That Zoom app, have you tried it?
So they are assessing the home environment, and once they assess the home environment,
I'm so sorry. Excuse me, Governor. We're having
Just
some.
follow the link that was on WhatsApp on the post chat, and it led me into it. It goes a little round,
they will
but
then
it
allow
works.
home
I'm
isolation.
on it right now.
If they do not comply to the standards, or the individual is not cooperating or being supportive of the guidelines, they will then be sent to SNU for now, but then we are looking at another facility, or we're adding another facility that would then house them in that facility. So if their home environment, so the guidelines for the home environment is that they have to have a separate bedroom and a separate bathroom, so that they only stay in that area. And if that's not, if the assessment is that that is not acceptable, we will take those people to the home, to our facilities of isolation. And so that home then is designated by
Mute your phone.
public health to be a designated isolation site. And then
Also, our
Sorry,
Department of
before we
Public
continue the
Health
press
staff
conference, if I could
monitor
just,
them. We always contact them very frequently, twice a day. We ensure that they are okay, and we also assess their conditions. And we rest assured that anyone that is in good condition, some of them are very asymptomatic, they have no symptoms, their condition does not warrant them, that they're very comfortable to be at home, and it meets, as the governor indicated, all the requirements for home isolation in accordance with CDC guidelines.
Okay, any other questions?
Sure, Chris Barnett, KUAM. Governor, how much of the results that we're getting, how much of that is playing catch up? Talking to doctors, nurses on a daily basis, they seem to be saying that we didn't test early enough. We didn't, introduce measures to mitigate the spread early enough. And so what we're seeing now is a backlog because we haven't done testing. How much of the results are we getting? How much of those are that?
Okay, so in terms of testing, Chris, we tested as soon as we got those test kits. But even before we got those test kits, we were already putting in our aggressive actions. So yes, there is a backlog, but we are also having other other professionals, laboratory professionals that are helping us now. And so Linda has more detailed update on that one.
Yes, absolutely. Currently, just recently, I made the phone call, and our laboratory has 51 pending. Off the 51, 40 will be run today, 20 in the morning and 20 in the evening. That results with a difference of about 10 left. So we're going to get caught up. As the governor indicated, we also have had the support from Guam Memorial Hospital, and we're getting a lot of their personnel to also be cross-trained so that they're able to handle our ABI 7500 machine. In line with that, I already signed a memorandum of agreement with the diagnostic laboratory services. So not only can we have the tests done through the state health department, but we can also have it done through DLS at Hawaii and also through Quest in California. And on top of that, on Sunday, 200 more test kits arrived. So we have a total right now of 210 test kits as we speak today.
So you're confident that in other jurisdictions, how they've been able to flatten the curve is by doing massive amounts of testing, and so you're saying that we're building that capability as we speak?
Absolutely, we're building that capability, and also commercial distributors and manufacturers for those test kits are being done at this point in time, and so we're hoping that the commercial laboratory will also be of great assistance to Guam.
So Sunday's test kit, that was the third group that went to Guam, the third group of test kits?
No, this is the second round of test kits that arrived. It was on Sunday. We were expecting it on Monday, but it arrived a little bit earlier. And of course, we continue to request for more. Every time they arrive, we request immediately so that we can continue to prevent shortages.
Linda, how far along are we with the trace investigations into the passengers that were on that February 29th flight? And then again, more recently, the news that came out last night that we had a couple of positive patients who attended bingo events at Hoffa Bingo.
What we're doing, our epidemiology department, and also with the help of Dr. Thane Hancock, who's working very, very closely also with our CDC advisor that arrived on Guam, they're looking at clusters of studies of all the cases at this point in time. When we determine that there are multiple clusters that are created or that we see happening, we are very much in active force to notify the public. And one of those things that happened was we saw 2 positive cases of 2 confirmed COVID-19 patients that frequent the Hoffa Bingo facility. And there's a possibility of the 3rd. And after we get the results today, we'll be much more sure of these cases. And so that's why we are informing the JIC to make the announcement to the public that if any of you had ever gone to this Hoffa Bingo establishment from March 6th all the way to the 16th, please contact our hotline, our medical surge hotline, which is a lot of our nurses that can triage you. Don't just go to the clinics. Call first. Get the information, the advice through phone triage, and then they will direct you exactly what you need to do. We don't want all the private clinics flooded with patients. We're trying to do social distancing. And so the best way to go is to have the triage done through the phone. And if you also can monitor yourself, identifying any symptoms that you may have, and of course, continue to monitor for any of those symptoms. And if you do have any symptoms, again, you can call the hotline and the nurses that are well-trained will direct you what you need to do next.
The next question would be for the governor. You just announced that you're extending the mandatory social isolation order. I think it was clear in just going around this weekend, I was well justified, but that people are not taking this order seriously. Is that kind of why you're extending it with some new restrictions? And then I guess the second part of that question is, are you going to retool and maybe look at some of the exceptions that you issued in the first order and maybe dial some of those back?
Okay, so for the extension of the 2 weeks, yes, it's absolutely because of that. But not only that, as we see more cases coming forth, we want to make sure that we extend out our aggressive directive of staying home, social distancing, and so forth. So 2 weeks, I think we would be able to contain a lot of that. Like Dr. Cabrera was saying, we want to flatten the curve. And I think we have aggressively put in very decisive actions, Chris. I just want to tell you that we learned of the positive cases on March 13th. The next day, I think we declared a public health emergency. And then 2 days or 3 days later, I then issued the closure of our government for non-essential business, non-essential services. And then as you can follow the history, we aggressively added more to it. So what I was doing was I was strategically looking at the best actions given the situation and even what we will be anticipating. And of course, I was guided by science and medical advice. So it wasn't done in any kind of void or vacuum. We used a lot of our medical experts, epidemiologists, CDC officials, even regular calls to the White House with President Trump and Vice President Trump, along with all the other governors. And I'll have to tell you, our actions are much more aggressive than the states. Governor Ige just a few days ago or yesterday said no arrivals or quarantining the arrivals which we have done 3-4 days ago. So I want the public to know that we are aggressively doing these actions. As far as the exceptions that we're talking about, what are they exactly that you're talking about?
Well, I'm saying when you have, you're allowing certain businesses to open, and I understand the necessity for that, but some of them, for example, banks operating with limited hours, we're starting to see, you know, a lot of people congregating. I mean, I know it's a drive-through, but there's just a lot of traffic being created, which I don't know, in your opinion, does that defeat the orders to stay home and stay isolated?
Right. You know, it's very important, Chris, to have people be able to get their cash, get their money. And I know we have ATMs, but they need to do more in bank face-to-face. And I know that most of the banks shrunk their staff and shrunk their services. Most of them are looking at just opening one branch to service the people. You know, there might be a situation where we ask them to close and just use ATMs. You know, we're monitoring this every day, and we are looking at what the cases are. I'm hoping that Dr. Cabrera is wrong, and not that he's not an intelligent man, and he's very futuristic. He also knows his data analysis and so forth, but I'm hoping he's wrong, and that I'm hoping that in these next few days, when we see more cases, that maybe it's only 2 a day, or maybe it's only 1 a day, or maybe it's only 3 a day, because that's really what we've been tracking, except for, I think, Sunday, where we had 11. And my understanding is they were probably the most high-risk people that was tested at that batch. So we're tracking this very closely, and we're making decisions quite rapidly. We're very flexible, and I am so comforted and satisfied that we now have a group of medical experts that are credible medical experts that know what they're doing, and they're in this area of expertise. So that has been a great help.
Can you tell us more about
in consideration of a complete government shutdown or a total island-wide lockdown? Is that something that's being discussed as well, and what would that entail?
Well, you know, Nick, if you look at everything that I have done, you might want to call it a lockdown. I'm not calling it lockdown because that means now I have to get all the security people, pull over people when they're driving. You know, I don't want to make it that sort of level yet, because everything that we have done and more is working. As Dr. Cabrera has said, if we didn't do anything, the spread would have been 200%. But because we instituted these actions, now it's 33%, and we're really banking on lowering that down to 16.5%. That's the reason I extended the 2 weeks. That's the reason I'm closing beaches and parks. That's the reason we're doing aggressive PSAs out there with our medical professionals, you know, and we're going to be doing more in terms of education. I especially am very, very appreciative of all the media that have done in terms of their own creativity to get the message out. So we need to work all together with this, and media is very crucial, again, like I said yesterday, into helping our community protect ourselves, our people in our island.
Governor, can you tell us more about the parks and beaches being closed down? You mentioned earlier that there were going to be some allowances made.
And the help that businesses can expect?
The reason the parks and beaches is, you know, Chris, our people are, like you said, they're not taking it seriously. They're, you know, they still do social gatherings in the beaches and the parks. However, you know, if they're going to go there just to run around the park or to walk in the park, that's acceptable, and that's really good, because we're telling people, get out there and exercise, walk, take your kids for a walk, you know, maybe bring them to bicycle riding, things that will occupy our children, because, you know, when they're really at home just cooped up, they go, you know, very active.
We'll take the next question from Kevin Kerrigan.
Yes, Governor, I'm wondering if you could tell us about the status of your disaster request and what help island businesses can look forward to receiving in the near future?
Yes, we are going to be sending the letter to request for declaration of major disaster area, Kevin, and you know our major argument there is that 60% of our economy is through tourism, and for all purposes, tourism is zero right now. And of course, that's going to have a great impact in our economy. And so we have the letter drafted. We will be sending it. The other thing is there's just so many packages being addressed and sent to the president, right? Second, there was the first one, which was the 8.3 billion. The second one, which was the Family Leave Act, I think it's called. And then now we're looking at the ones where for employee benefits and so forth, and the economic stimulus. So all of the 50 states, governors of the 50 states have asked the president that when these packages are signed and ready for implementation, that they give the governors a lump sum, a block grant, so that we can then distribute it accordingly as to where the needs are. I don't know if the president is going to do that, but if not, I'm pretty sure that those grants, those awards are going to filter on down to Department of Labor, to FEMA, to economic stimulus. We have already been approved for the economic injury disaster loan program, which is through SBA, which is giving people up to, I think, don't quote me on this, but up to, I think, 2 million. Maybe not that high, but there's certainly a disaster loan program that is going to be available for Guam because we have been approved for those grants.
Can you also clarify for us, what are the rules currently in place for quarantine on arrival? From the Philippines, it's mandatory. From Japan and elsewhere, is it voluntary or what?
Okay, so everybody really is voluntarily quarantined, and people who are U.S. residents of Guam, if they're coming from the PI, we tell them you're voluntary, but I don't know whether you say voluntary mandate or something. Linda can do that. But yes, for the Philippines, we have provided the facility for them to be quarantined, because the reasoning behind that, as you know, most of our cases are from the Philippines. And so I wanted to really target a very strong source of contamination. So the rest, the non-residents, they go to the hotels. The residents that come are self-quarantined, and then the Philippine ones are mandated to go to a facility so we can better control that.
Those in quarantine now, will there be
How that works, especially for those that are coming in from the Philippines, is we will issue at the airport, our nurses will issue a volunteer quarantine letter. They will sign it, they will explain what it's all about. Now, if they refuse to sign it, then we will just write in refuse to sign. And then after that measure is taken, we will then issue a involuntary quarantine order. And that is what they need to sign. And while that is being done, our nurses will identify through an Excel spreadsheet all the passengers that have arrived, identifying if they're agreeing to voluntary quarantine or involuntary quarantine, because they didn't agree to voluntary quarantine. And also we'll have the name of the hotel, the room number, and their contact information there. And then we will also present that to the court just for those that are being involuntarily quarantined. I will then have to present myself at court, which I am due to be presenting myself to court this week, and go in front to get the court order that this measure of an involuntary quarantine will be supported and issued by the court.
How many?
We have room just for a few more questions.
Okay, can I have one question? Please?
Go ahead, Marvick.
Since the system is already hitting full capacity, do you have a contingency plan if we fail to flatten the curve?
In terms of the hospital,
Yeah, I can. Hi, Marvick. Yeah. So basically, when we get to that threshold point, we are not going to stop providing care. We're going to continue providing care as best as we can and as aggressively as we can. We're already taking extraordinary measures to make room and get as much personnel as we can and to help do this. So we're doing the best we can, but the true reality is that once that threshold is reached, is that we are going to start being able, our standard of care is going to go down significantly, and we're just not going to be able to keep up. And at that point, that's when actual deaths are going to start really picking up. And one of the things why I'm really focusing on this, because this is our most immediate threat. I'm talking about this happening later this week into next week as well. And so, but we can do things now. And one of the things I'll show you is a personal example of what I'm doing with my own mother, for example, who's a manamko, and she has her own chronic medical conditions, but she feels great. She wanted to go out and go to the bank and go to the store today. I said, absolutely not. You're staying in your room. I'm sorry. I love you. And I talked to her through the phone. I didn't even do this face to face. And she's completely understanding, and she knows why. And I wouldn't say anything to the public or to any of my patients that I wouldn't do to my own mother. And so that's how serious this really is. And I think we all need to do that right now, because that's what's going to really make the impact today.
I have a question regarding the confirmed deaths.
Go ahead, Nick.
In regards to the first confirmed death for Guam with the linked to COVID, did the woman get dialysis prior to being admitted to the Guam Memorial Hospital? And if so, when did she get that? And have the clinic's clients been contacted?
Lillian can answer that question for you.
Yes, she received her regular dialysis treatment the day before she came into the hospital. We also continued her scheduled dialysis in the hospital while she was in the hospital.
So have the patients at the dialysis center been contacted as part of the public health investigators tracing?
Yes, we have been monitoring the dialysis center as well. And we have been also, we tested about 2 of those areas, and we have been strongly contacting all of them and making certain that they're doing fine. And I continue to be in contact with the dialysis center.
Okay, just a couple more questions.
Is there any word on procuring more WHO-approved test kits from other countries? Any updates to that?
Dr. Cabrera, because he's the medical technology specialist also.
Yeah, I can attest to that. So we've been working both GRMC, DLS with Public Health Lab as well, into really opening the channels of being able to test. So Public Health right now is using the ABI 7500 that's basically from CDC. But the FDA has been fast tracking these approvals under emergency use authorization for other commercial type labs. What's great is that Public Health also has a different PCR machine to run tests, and GRMC also has that exact same test, and that got FDA approval just yesterday. And so we're already in the process of GRMC taking our gene expert and moving it to Public Health, because we can run tests way more efficiently that way in terms of reagents and sharing staff as well, and cross-training. And this is going to be a battle that's going to go on for a while, and so we need to start doing that. Is testing going to help us right now within the next week? No. Everyone assuming that you have
Yeah, because he's talking.
everybody else has COVID is what's going to help us right now. But this may be a battle that extends for months. And so we're making these contingency plans as well. When will we get these gene expert test kits? It's unknown, but we actually got ahead of the game because we saw there that they were anticipating the FDA approval. So the orders are in, and it's a matter of when it gets in, and then we're going to be able to go from both fronts.
Next question, last question.
Okay, one.
Marvick?
Oh, does the
Sorry,
military,
who is that?
does the military share information with the local government regarding the status of people on base? I heard that one person died this morning. Have you heard of that?
No. Okay, so Marvin, we do communicate very closely with the GRM, and I talk regularly with Admiral Minoni. My chief of staff talks regularly with his chief of staff. And so Admiral Minoni is following our mandates and our directives. And so as far as expired person, no, I have not heard anything. Public health has not heard anything.
It's not COVID.
Oh, it's not COVID. Oh, but not, anyways, we don't have any reported deaths as a result of COVID-19.
Just that one.
Just the one that happened, unfortunately, yesterday.
All right, Governor, with the numbers we're seeing here from Dr. Cabrera and just all the information he's downloaded on the community, what's your message to keep the calm?
So my message is this: we have aggressively done what we have done earlier. And as a result of that, this is why we're seeing not the 200% spread, but the 33%. We are going to continue aggressively doing actions and decisions to lower that down. So then my goal is to have no cases every day. That's my goal. What my message is to you is to help us stay home, wash your hands, sanitizers, cover your cough. You know, these are the messages that are very consistent throughout. You guys have done that messages. We continue to do that messages. And what I say is we have medical experts here. We have CDC experts here. We have direct communication lines to our federal counterparts. We actually have all the resources and the talents that we have here locally. Let me tell you this, Nick, just remember this thing happened a week ago Sunday, right? From that time, we have instituted things that are unprecedented. We have instituted things that even other states have not done yet. So I want to assure the public that we have the expertise, we have the means, and we have the knowledge and the data so that we can anticipate and so that we can work it, so we can, flattening the curve is very important. And in order to do that, I need our whole community to follow the directions, follow my decisions. Let's all work together, not against each other. This is like us hunkering down during a typhoon. And so we need to just continue that. We also are very appreciative, like I said, of the media and your help. Really, if you could just continue that, you guys are going to be very significantly influencing the course of this virus. And this is a situation that's even bigger than World War II, serious. And take care of our manamku, please. The people of Guam, take this very, very seriously. We need to prevent further deaths. And it's through your work, your cooperation, your support, your calmness, and togetherness, united, we will prevail.
Thank you, everybody.
Thank you, Governor. Be safe.
Great ending.
Thank you.
That was,
I know,
you
right?
needed that